So welcome, my name is Amy Smith. I am the Bariatric Program Manager here at Northeast Georgia Medical Center, where we help our patients get to a healthier weight, either through medical weight loss or through weight loss surgery, things like the sleeve gastrectomy or the Roux-en-Y gastric bypass. So I'm really excited today to be joined by Dr. Eric Velazquez, who will be joining our Bariatric Center of Excellence soon as a Longstreet Clinic bariatric surgeon. So we anticipate him coming to join us in October. So thank you so much, Dr. Velazquez, for joining us this morning and having taken some time to talk with us this morning.
Thank you, Amy, for having me. I'm excited to join you guys.
Me too. So can you tell us just a little bit about yourself?
Absolutely. So as you mentioned, my name is Eric Velazquez. I'm a general and bariatric surgeon. Been in practice for a little over 10 years. I'm originally from Dominican Republic, did my general and bariatric training in New York State and in New York City. I'm a father to two wonderful boys, a 3.5-year-old and a 5 months old. So, we're not sleeping a lot recently. I love spending time outdoors with my wife and my sons. We love hiking, mountain biking, and our passion is actually taking our Jeep off-road.
Oh, okay. And so you're moving down to the North Georgia mountains. And so that was going to be one of my questions is what brings you down south? Because you're currently up north, but what brings you here to Georgia and what made you choose Longstreet Clinic and Northeast Georgia Medical Center?
So, I'll try to make the story short, but I went to medical school back in Dominican Republic, did my surgical training in New York City. And then after my training and fellowship, I actually moved to North Carolina. So I'm familiar with the South. That's actually where I met my wife. So, due to career moves, we ended up moving back to the Northeast. We're in Philadelphia now. And, we always knew that it was going to be temporary, that we will come back to the South. So we started looking for opportunities, and we knew about the area in the Northeast Georgia area. And then I found the Longstreet Clinic. The reputation of the Longstreet Clinic precedes the organization. And the bariatric surgeons there, Dr. Robert Richard and Del Mazo, are well known within the bariatric community. So for me, it was a great opportunity that I couldn't pass. So I met them, we immediately connected. We realized we have the same values, the same ethical principles. And, we decided that we're going to practice together.
Great. Yeah, you're going to be a wonderful match for our program. So super excited for that. What made you specialize in bariatrics?
So, believe it or not, I always knew I wanted to be a surgeon. My dad is a general surgeon. He's retired now, back at home. And I grew up saying I want to do what my dad does. So through medical school, I was, like a horse with blinders, very concentrated. I wanted to do surgery. Through medical school, and on my 4th year of medical school, I actually wanted to do plastic surgery. So then when I came to the US, started my training in New York, as I advanced through the ranks in the general surgery residency and started doing big abdominal surgery, involving the bowel and the stomach, I discovered a love for that, and the love for plastic surgery fade away. Then I'm always inclined in technology. I'm interested in technology. And I try to find what does that marriage between the big general surgery involving the GI tract and technology. And that's how I discovered minimal invasive surgery and bariatrics. As you know, this field, we use laparoscopic instruments. We're always at the edge of technology. Now we do robotic procedures. So it was, a marriage of two of my passion. And that's how I decided to follow that career. Once I started my fellowship and started learning more about obesity and the patients affected by obesity, then I discovered another passion within that field. And it's the fact that if you think about it, any other surgical specialty is a very brief interaction with the patient. The patients come with a surgical problem. We do the surgery to correct that problem. And then if the patients go well, you don't see them again. As you know, that's not the case in bariatric surgery. We really establish a relationship, a rapport with the patient before we even perform surgery on them. And then after performing the surgery, we continue to follow them. We establish a long-term relationship with them. And, it's one of the things that I enjoy the most about this field. I love watching patients, even after the surgery, achieve milestones in their life. I'm certain you have witnessed that. The young patients, when they go ahead and get married, and then they have kids, and then you get to meet their kids, or even after the weight loss surgery, there's career changes or changes in their lives. So all of that really fulfills my day. So it's a wonderful field to be in.
Absolutely, I agree. I love watching those patients come in, especially at that 6 month after surgery mark, and they're completely different. We actually had a patient on our closed Facebook group this week that shared that she went skydiving, and that was her ultimate goal after losing the weight. And so watching people achieve their goals is beautiful, and that's what makes this line of work so special.
It's amazing. I had this patient, I always think about her because she's from South America, and she loves, football, that here we call soccer. And she loved playing it. Due to being affected by obesity, each time her game was, becoming detrimental, to the point that now her friends were not including her as part of the team. She had to sit in the bench for some games because she will get winded. So she underwent a sleeve gastrectomy. And I'll tell you, within the year, she achieved her goal weight. Now she's winning trophies on her league. She's playing 6 consecutive games, and now her friends are the ones that have to sit on the bench because they're like, I can't keep up with you. You have so much energy. So seeing it so happy, and when she shares her pictures with her trophies and all of that is a huge satisfaction.
Absolutely. Oh, that's a wonderful story.
Yeah.
So thank you so much for taking the time to talk with us. We look forward to seeing you in October. I'm going to share my screen here so people know how they can get in touch with us. And we will see you very soon.
Thank you. Thank you for having me.